In this video, we're going to be talking about using the AED, the automatic external defibrillator. For the purpose of this video, I'm just going to run through some of the important features, etc., and then we'll go through a whole scenario using the AED. The machine will give us instructions, so we need to turn it on and follow the prompts. Some of the safety features that we need to consider here is that we're not moving the patient, we're not in contact with the patient, and we're not in an explosive environment when we're using the AED. One of the first things that the AED is going to ask us is to send for help. So we've already done that. In a previous video, we discussed the action plan of first aid, your primary survey. It will then ask us to go through and remove all clothing. If you've got a female patient, the bra needs to come off. With your AED, we do have a little rescue kit with some items in this. One of those is wipes, to be able to wipe the chest if the chest is wet. We've got shears that we can cut through the clothing and make sure we can cut through the bra if we've got a female patient. The bra needs to come off because it's got wire in it, it's metal, and it can arc. We also have a razor. Now, it's very important that you check your kit before you need to use it. You look at this and that doesn't even look like a razor. So it's important to know what equipment that you have got in your AED. We also, as I mentioned just previously, if we have a female patient, it's vitally important, well, to me it is, to protect our patient's dignity. So if you had something, the patient was wearing some clothing like this, it may not even be required to take the whole shirt off. Or you could take it off, once we've got our pads on, put our clothing or put the shirt back over the patient to protect the patient's dignity. I always talk about, thinking about if this patient was your wife, your partner, your mother, your daughter, how would you like them to be treated? So that's important to me. So now, following our little introduction into the defib, we're now going to ask Wade to come on through, and we're now going to run through the operation of the defib.
Training mode. Call for help. Follow instructions to apply pads. Remove clothing from patient's chest. Locate pads package in back of AED. Tear open pads package. Peel pads from blue liner. Apply pads to patient's bare chest as shown. Remove flow. Analyzing heart rhythm. Do not touch the patient.
Move back, please.
Stand clear. Shock advised. Charging. Press flashing shock button. Shock 1 delivered. It is safe to touch the patient. Begin CPR now. Give compressions.
So I've just taken you through a normal cycle for the AED. So this will now take us through 2 minutes of CPR. And once that 2 minutes is up, it will then reanalyse. So if we take it now that the AED has reanalysed and it says no shock advised, check patient. This is where we run down through our DRS ABCD again, and we now find our patient may not be responding, they may be moaning or groaning, but they're now breathing normally. So here now, we would then roll our patient over on the side and clearing the airway, checking the airway, monitoring the patient.